and they're getting much more reasonable now. So hopefully there'll be more of them. So hands go on the table, ready to tap. What is the first P of first aid? Oh, it's over there.
Preserve.
Preserve life. Make sure you catch it. Oh, good catch, Ben. Good catch. Okay. It's a difficult one, so we've got 2 up for grabs for this one. Can anyone tell me what CPR stands for? Ooh, there's one there.
Cardiopulmonary resuscitation.
Cardiopulmonary resuscitation. Very, very good. Okay, when doing chest compressions, how deep do the chest compressions need to go? Oh, it's Tom!
5 centimetres.
5 to 6 centimetres, okay? So you got a good catch. How many rescue breaths do you need to give the captain? Ooh, it's 2 in between your compressions, that's it. And can anyone tell me what the first D is that you need to check for on a primary survey? Oh!
Danger.
Oh, and he was the only one that went for it. It is danger, okay? Okay, so now we're going to look at the secondary survey. So the scenario here, and you have to get this very, very clear in your mind, and I've got a little sheet at the end that will help you to do that. The scenario here is that once you've checked if somebody's breathing, if they're not breathing, you need to get help, you need to commence CPR, you need to get a defib on its way. But if they are breathing, you would then commence with a secondary survey. Because what you're trying to do is to ascertain all the reasons why this unconscious but breathing casualty is lying on the floor. Okay? So, what we're going to do, we're going to have a look at the secondary survey now. So if we jump up again, come back over here. Is anyone that wouldn't mind just being a body for me for this? So, we're going to look at the process that we would make if we come across, it's actually 2 scenarios. It's if we come across somebody that is unconscious, they're lying on the floor, but they are breathing. The other scenario is that if we're using CPR and our casualty suddenly regains consciousness or begins to have a heartbeat on their own or breathe on their own. So those are the 2 scenarios. So Tom, bravely volunteered, well done. Lie down on your back. Now, it doesn't really matter with the dummy because you can't really kill the dummy, but we'll wish Tom all the best for this. So we're going to come back, now we're back into the scenario that we were. So first thing I'm going to do is check for danger, and then I'm going to check for, okay. Anyone remember what that acronym was? AFPU, right? See whether or not it was alert. And I'm going to say, hello, can you hear me? Open your eyes if you can hear me, okay? If I have no response, the next thing I'm going to do is just check his airway to see whether or not there's anything in his airway. If his airway is clear, I'm then going to do what? I'm then going to make sure I bring him up, and I tip the head back slightly, the cheek, the ear, to the mouth and nose, look along the line of the chest. Good news, okay? He's breathing, okay? So now what I'm going to need to do is to try and get some idea as to why he might be lying there. It's called a secondary survey, okay? Now I'm going to start by taking my hands, gloves whenever possible of course, and I'm going to run my hands around the head and the base of the neck, okay? And I'm going to check by looking into his ears, okay, to see whether or not I can see any form of discharge coming from the ear, okay? A light straw-like blood coming out of the ear usually indicates a skull fracture. Not good news, okay? So I'm going to check around, and when I get to the base of the skull here, just bringing my hands down into the base of the neck. Why might I check the bottom of his neck like that?
Because if the neck's broken, it will be on the floor. It'll still be.
Yeah, because if I ask Tom to try and get the lower part of his neck where my hand is flat against the floor, can you get it flat against the floor? I can't do it, okay, because the cervical's got a bend in it. If that's flat to the floor, it usually indicates a broken neck, okay? So if we do that, and we find that it is flat, and we suspect we see some straw-like blood coming out of the ear, we're going to move them? No. Okay? So I'm going to check around the head, check around the neck, check the ears, and once I've done one part of the body, I'm going to look at my hands. Why would I look at my hands? To see whether or not there's any blood, okay? Then I'm going to move up to the upper body. I'm going to be pressing to see whether or not I can feel any form of abnormalities. I take one arm, Now, don't pat. If you pat, you might miss something. Okay, so check by running your hands down, checking the fingers. When I get here with Tom, I'm going to just take his sleeve up and look at his wrist. Why would I do that?
Check wrong.
Any form of medical bracelet or anything like that. And we're being very careful as we go along the body. And then I'm going to check the sternum, the centre of the chest. Always a good idea just with the back of the hand. Just apply a little bit of pressure and see whether or not there's any form of response, because pain is one of the last things that an unconscious person, response to pain is one of the last things an unconscious person would lose. So even they might be unconscious, they might flinch when you come across something that is painful. I'm checking again, might check the abdomen as well to see if there's anything there. I'm checking my hands all the time. Every time I do one part of the body, I check my hands, okay? Move down, check the leg, see whether or not there's anything that's abnormal, both legs, okay? And if I find nothing, it's safe to assume then that I need to take my casualty over into what's known as the recovery position, which is a safe position, which is going to maintain his airway and allow for any drainage should I need that, okay? Now the way that we're going to do that, do you have a question? Yeah.
I've always been taught we have to apply a bit of pressure or feel the hips.
Okay, they're bringing the hip rock out. They're taking the hip rock out, okay, because they're concerned about spinal injuries if you move the hip. I mean, if you get to a position like this and you can't feel anything through the back like that, you know, sort of moving, because if someone's got a spinal injury, do you want to move them? No. So they're starting to take the hip rock out. Yeah. Okay, so I'm going to turn him over into the recovery position. So I'm going to take this arm. I tend to lay that arm. Some people do it in a stop traffic way, which is fine. That's perfectly all right. Some people have it straight. I mean, either is fine as long as it's effective. That's okay. And I'm going to take his opposite hand, bring his opposite hand up, so I place it up by his cheek. Reach down, take the knee, and I'm going to lift his leg up. You're unconscious, Tom. Lift his leg up, and then I'm just going to pull this leg over and watch what happens. And even if you've got quite a large person, it's genius whoever invented this. I'm going to shuffle my knees back and bring him over into this side position. I'm going to bring this knee up, pull this knee towards me, and then very carefully I'm going to place his hand down in his head, making sure that he has that slight tip. Do you see this tip to the head? Because this helps to maintain that airway. And then I just make sure that we've got a little bit of room in there. And I have him in this recovery position now. And it's this point that I go and get the ambulance. Okay? So do you see that you get to a certain point and the paths split depending on what's happening? Because the priority is always ABC. So if there's no breathing and there's no circulation, you have to crack on with CPR. Okay? And that's quite, sometimes people fall asleep, Tom. That's the recovery position. Okay? Right, does anyone would like to try putting someone else in the recovery position? And going through there. Who didn't do the CPR? Right. Right. Come on, someone's got to do it. Alex, lie down. AJ, give it a go for me, come on. Good man. So, the first thing you're going to do, AJ, is you approach and look for danger. You assess the danger. And then the second thing you're going to do is
see if they're responsive.
See if they're responsive. Off you go.
Hello, can you hear me? Hi.
Perfect. So he doesn't respond. The next thing we're going to do is check.
If he responds to pain.
That's right. Yeah. So you part of your alpha, you get a little press. Can you hear me? Reaffirm with your voice. Can you hear me? Open your eyes if you can hear me.
Can you hear me? Open your eyes.
Perfect. No response. Okay. Then we're going to check what?
Obstruction in the airway.
So we're going to open his mouth. We don't need to pinch the nose at that point. Just need to open the mouth.
Yeah.
The good news is unconscious people, their mouth opens very easily. Okay. So we're checking there. Can't see anything there. Next thing we're going to do is
check breathing.
That's it. So to check breathing, we're going to tip him back a little bit to open his airway right up.
Yeah.
And then we're going to put our cheek and our ear and look along the line of the chest. How long for?
10 seconds.
10 seconds. Good news, AJ.
He's breathing.
He's breathing. Okay. So then we're going to do what?
Alright.
Yeah, you see.
Secondary survey. At that point,
That's
he's breathing.
it. There. So he's
how
breathing.
many-
There you go. So first thing that, let's say he was wearing a hat. What would you do?
See, that's what I'm confused at, because you know, like if it's a helmet or something, you don't touch it.
No.
But if it's a cyclist helmet, would you do it then, or would you leave it? Or?
No, if it's a cyclist helmet, the best thing to do with a cyclist helmet is to leave it on. But the good thing about cyclist helmets, they have air vents and gaps in them, okay? So you can peek through the gap to see whether or not you can see. And also with head injuries as well, if there is a significant head injury, you're going to see blood around the area as well, okay? Well, what I wouldn't be doing is taking on his hat and putting his hat off for sure. But I would just check with my hands on the outside of the hat to see whether or not there's any bleed through. Because trust me, with a hat like that, if he had any head injury, there would be bleed through, okay? So you check, you're going to check around the neck as well.
Yeah.
And then once you get to one area of the body, you're going to look at your hands.
Yep.
Perfect. Then you're going to go onto the torso. Back of the hand is always a good idea, especially if you're dealing with a lady, just in case it turns out that actually they weren't, they were just in a deep sleep. Okay, check around the rib cage, and every time you do that, you're bringing your hands up just to look perfect, okay? We move on to the arms. And again, don't pat the arm, don't pat the leg, run your hand along it, get to the wrists, you're going to check, see whether or not there's any bracelets on there, you might have a look at the fingers. Very, very careful as you reach the other side of the body as well, okay? Sometimes people get up and walk around if it's difficult for you to reach over. We check all the way down, trying to get our hand right the way around the arm. We check for bracelets again, looking up palm of the hands. Perfect. Very good.
Anything particularly we're looking for in fingers?
No, I mean, at the end of the day, if someone has a form of broken fingers, then that's the least of their problems, perhaps if they're unconscious. But what might you see on someone's hand that's unconscious? You might see electrical burns, okay? So what you're aiming to do is to give the paramedic as much information as you can when they arrive, okay? So if you say, well, unconscious when I found him, he seems to have a really bad burn on his hands, you know? Yeah, they're used to the scenarios, yeah. But that said, you know, if there is an electrical issue, you've got to be very careful of your own safety, because how did that person get that shock and how did they end up on the floor, you know what I mean? So you've got to look for wires and cables and that kind of stuff, okay? We'll go down one leg then the other.
Yeah. Is it same again, don't pat it, feel it?
Feel it all the way down, because you're looking for any form of abnormality, anything sticking out, anything bleeding, yeah. Get right down into the end, check your hands when you get to the end. Perfect.
Yeah.
Perfect. So far then, what we know about him is he's breathing, he's unconscious, but he is breathing, okay? So we can't find anything at all, so we're going to move him, okay? Take the closest arm, bring it out to the side, but you can stop traffic. Some people can't get their arm flat. If that happens, straight the arm, that's fine. Take the opposite hand, you go palm to palm, and you take it up to his head. Perfect, very good. Reach down to his trouser leg, pull up his knee, his foot goes flat on the ground, and then as you rock that knee towards you and you turn him onto his side, you just shuffle back with your knees. Over he comes. Perfect, very good. We're looking for that slight head tip to make sure that it maintains his airway and helps for any drainage, meaning if he's sick or anything like that.
So with the legs, would you bring, where it's crossed over like that, would you bring it round? And
Yeah, I mean, there's no hard and fast rule to it. He's in a recovery position. He's in a better position than he was. But one of the things you've got to be careful of course, is that if he's not in a perfect position, he could roll back. Because once his upper body starts to turn, his legs will go. So to be absolutely sure that he's not going to, if you do that, there's no chance of him rolling back the other way. Okay? Any questions on that? Perfect, what a great actor. Excellent. So we come back then, we're nearly done. So that's secondary survey, top to bottom. You see gloves when possible. All first aid kits all to have gloves. And that's our recovery position, which we talked about. You see how I'm shuffling away in that position and having that person tipped on the side to maintain the airway. And this is a really good final recap to it, really. There's your danger, you've got to check that it's safe. You have no response. What was the acronym again for checking for response? AVPOO, yeah, okay. And then we're going to open the airway, and then we're going to see whether or not they're breathing normally. Do you know why it might say normally?
In case of short, fast breaths.
Yeah, Admiral breathing. It's not very nice, but it's as the body begins in an unconscious state, if it's getting deeply unconscious, there's two things that can happen. One is Admiral breathing is a deep responsive thing that the brain will do as someone is going unconscious, and it's a very, it's not very nice. It sounds as if someone's breathing, and it's very often mistaken for breathing. The other thing that they can do is hypoxic shock, where someone's literally they seem to have some sort of fit, and they can make noises. You're not in for a good time if you come across something like this. But like I say, doing something is better than doing nothing. So are they breathing normally? The answer is yes, they are breathing normally. Then we're going to go to the recovery position, and after we've done the recovery position, there he is, look. We're then going to call the ambulance. If the answer is no, they're not breathing normally, then we're going to call an ambulance, and then we're going to commence our CPR. 30 chest compressions, 2 breaths. 30 chest compressions, 2 breaths. So do you see where it splits? Is when you check for breathing, okay? And if the answer is yes, they are breathing, then that's when we've got our secondary survey and we go to recovery position. If they're not breathing normally, then we're into the fast game, we're into CPR.
And the CPR, you'd carry that on until the emergency services arrive?
Yeah, unfortunately, you've got a number of options. You keep going until you're so physically exhausted you can't do it anymore. And that's why you've got to keep your arms straight. Because if you bend your arms like that, it's much more taxing, okay? When the emergency services arrive, unfortunately, as Michelle has known firsthand, the first thing they say to you is, "You're doing a great job, keep going." And you're like, "Well, I've been here for God knows how long." And what's the other option that might happen though? So if someone's called an ambulance for you, if you tell someone to call an ambulance, what would you say to them? Just as they were running off, "I'll call you an ambulance, Tom, no problem." I'll go out the door, what are you going to say to me?
Come back.
Come back and tell me you've done it, right? When I come back, what can I do? Right, so you might have to say to somebody, kneel down on the other side of the casualty, place your hands the way I am, press down on the chest, 5 to 6 centimetres, 100 to 120 beats a minute. And when you do it, count out loud, because you need to know when to get breaths in. You start using oxygen therapy and AED, it's important to know where someone is in that cycle. Yeah. And you keep going till either someone more qualified than you tells you to stop, because they might be putting pads on, or another reason they might tell you to stop, or the other reason would be that they pink up and they come back. Okay. Any other questions on that? Okay, so now what I need you to do is just grab your pen and see whether or not you can win a black Mercedes that doesn't exist. And if you answer those questions for me, that would be great. And shot through those with such confidence. Brilliant. Any other questions?
So then, when you're doing the 30 chest compressions, so is there any reason on why it's 30, or it's just?
The body will maintain its tissue health on a very low amount of oxygen in your body, which is why Vinnie Jones didn't do the mouth to mouth in the advert. Remember that? Push down hard and fast on the sovereign, okay? Because there's enough oxygen in your blood to keep your body going for a reasonable period of time, okay? But if you have no circulation, there's absolutely no chance of that happening. So that's why you're doing compressions in the first place. And sometimes people say not to give the 2 breaths, but if you're there for any extended period of time, sooner or later someone's going to need breaths. But 30 is just the researched amount from the European Resuscitation Council, soon to be the British Resuscitation Council, I should think, as to how many compressions you need to be able to get a circulation of that oxygen to go around the body at one time. That's what it's for. So you're trying to maintain healthy tissue, to stop tissue dying, by circulating the oxygen in the blood. You're breathing and pumping for somebody else, and 30 is the amount of compressions. It does vary a little bit with different age groups. Any other questions?
What's the age in which you would start of a patient when you start doing full chest compressions and CPR?
You do full chest compressions and CPR either on a baby or on a teenager. The only difference being is with a baby you use 2 fingers, so it's a sharp 2-finger push, and with an adolescent or a child it's one hand, and it's a one-handed push. But you'll know because you need to be able to get that depression in the chest, and obviously if you're doing 2 hands on a very small child, that can be, However, doing something's better than doing nothing, and cracking a rib is the least of their problems if you're doing CPR on them. So with a baby, with a pediatric, it's 2 fingers, and with a youth, it's palm of the hand. But it's a slightly different approach. Okay. Any other questions?
With a baby then, for example, year-old, what would you be looking for? An inch, 3 centimetres of compression instead?
Yeah, it would be around about 2 to 3 centimetres, and the compression is slightly faster because it's up to about 140. So it's a like that with a baby, yeah. And the mouth to mouth, not mouth to mouth, mouth to mouth and nose, yeah.
And Annie there, she gave that helpful click as feedback.
Yeah.
Is there anything like that on a real person?
No. Sometimes you do hear clicks, which might not necessarily be associated with the CPR, but you're looking for a depth of 5 to 6 centimetres. That's what you have to do. Any less than that, and you won't be pumping the heart effectively. So no, it's literally as you just did it there. That's the depth that you need to do, and if you don't do it, then their chances of survival are nil.
And if you do your primary survey and you think someone's leg looks really, like, not primary survey, secondary survey, and someone's leg, for example, looks really misshapen,
Mangled up. Yeah.
would you still put them in the recovery position?
What's the priority?
Airway.
Okay. So if my leg looks like it's twisting out at an angle, it's pretty clear I've got a broken leg. Okay. But if I'm staying on my back and my airway shows down and my breathing stops, my broken leg is the least of my problems. The only thing that you might do is turn the casualty towards the broken leg. Okay, now people go, that doesn't make sense. Why should it be towards the leg? Why wouldn't it be away from the leg? You turn them towards the broken limb or the broken arm so that the weight of the body or the weight of the other limb acts like a bit of a splint and tries to keep that leg. It's the best option that you've got. But the priority is that, because without that, there is no life. Yeah. So if you have a broken limb, your priority is to maintain an airway. Yeah. Any other questions? Well, thank you very much, everyone. Thank you very much. Bless you. Might still be 1 or 2 sweets if you're lucky.